I'm Dr. Ginevra Liptan, an internal medicine physician specializing in the treatment of fibromyalgia and fibromyalgia-related conditions. Restless legs definitely falls into that because about a third of all people with fibromyalgia also experience restless leg syndrome. And what restless leg syndrome really means is that when you try and kind of lay down or rest, that your legs, or sometimes your arms actually, can be experienced both in legs and arms, feel an uncomfortable kind of sensation, like you really need to move them. Some people describe it as feeling like there's bugs crawling under their skin. Other people feel like it's sort of like a pulling or stretching or creeping sensation, and that really the way to relieve it is through movement, shaking out your arms or legs, or even sometimes people have to get up and walk around to make the symptoms ease. So it can actually be pretty miserable and really interfere with sleep. And as you know, in fibromyalgia, sleep is key. So today I want to talk about 3 natural treatments that you can use to reduce restless leg symptoms. Now, there are absolutely medications that can help, and those are perfectly reasonable options. Some of them do have some side effects, and I do think it's worth at least trying the natural approaches, as many of them are quite effective and a lot easier to tolerate. What are the 3 natural treatments that can ease restless legs symptoms? Iron, magnesium, and CBD or cannabidiol. So first off, let's start with iron. And why does iron matter for restless legs? We know that restless leg symptoms are caused by low levels of dopamine in certain areas of the brain. And our body needs iron to produce dopamine. So what we see in restless legs is low iron causing low dopamine levels in the brain, causing restless leg symptoms. So if you can improve the iron, you can get more dopamine and less restless leg symptoms. The most commonly used test for iron levels is ferritin. And ferritin is kind of a rough marker, a rough estimate for how much iron is in your bloodstream. So Western medicine does not call it iron deficiency unless you have a ferritin of 10 or below. And the tricky piece here is that what's considered a normal ferritin might not actually be enough if you're having restless legs. And if you are somebody that has restless leg symptoms, you really want to aim for a ferritin that's more like 70. So the first thing to do, if you think you might be low on iron and that might be causing some of your restless leg symptoms, is to go to your doctor and get your ferritin levels checked, and then to take iron supplementation to bring your ferritin up to about 70. Now, of course, you can get too high. You can get excess levels of iron in your body, which are dangerous. So you want to make sure that if you're repleting iron with supplements, that you are getting your ferritin levels monitored and working with your doctor so that you know that you can kind of make sure that your ferritin is staying around that kind of 70 to 90 sweet spot. There's a couple different ways that you can bring your iron levels up. The first is by taking iron supplements. So there's iron pills of all different forms. Iron can be a little bit challenging to tolerate. Some people find it makes them nauseated. Other people find it can be quite constipating. So you want to make sure that you're taking the form of iron that is the most well tolerated. And what I've had people have the most success with is a form of iron called iron bisglycinate. Now, this seems to be the gentlest and most easily absorbed form. That's a really good place to start. If you try that form of iron and you just can't tolerate it, there are alternative approaches. And one is actually you can absorb iron through your skin. So you can get compounded topical iron creams, and you can rub them onto your skin, and you can absorb some iron that way. One issue with that is that there can be some skin discoloration, so that's not my favorite option. But for a long time, it was all we had when you were looking at topical iron. But now there's actually some iron patches that can deliver iron through your skin without any of the discoloration or kind of messiness of the compounded iron cream. So the one I really like is made by Patch MD, and there's a link below if you want to check that out. And I've found that if people really need iron but they can't tolerate it through their stomach, that doing the topical iron patch is a really good way to get their iron levels up in a way that's really easily tolerated. The second option for treating restless legs naturally is magnesium. And magnesium is what I like to call the relaxation mineral. So it can help kind of relax and soften your muscles. It can help calm down some of the crampy, pulley, uncomfortable sensation in the legs. And I found it to be a really effective option for mild restless leg symptoms. And you can, just like iron, you can do magnesium orally or topically. So I'll talk a little bit about those two options. The best form of magnesium in my experience is magnesium glycinate. That's the form that's the least likely to have any laxative effects. Magnesium, unfortunately, when taken in larger quantities, can have diarrhea or loose stool inducing property, which is not fun. So I found with magnesium glycinate that occurs much less frequently. So that's usually what I have people start with as far as oral supplementation. And just globally for fibromyalgia, most of us are magnesium deficient. So most folks need a little bit of magnesium supplementation, particularly before bed. If you also have restless legs, I usually just have you take kind of more magnesium. But let's say you try magnesium glycinate and that still is not tolerable and you're having loose stool. Then you can actually do magnesium topically. There's a lot of different magnesium lotions and oils and creams. It's a really good way to get magnesium right on the spot that hurts, whether it's on your legs or arms. Many patients have in fact reported that cannabis or marijuana is helpful to ease their restless leg symptoms. We don't know exactly which chemical within marijuana is having that effect, but it looks like it might be primarily due to the CBD or cannabidiol, which is one of the non-psychoactive components in cannabis. I have found clinically that a lot of my restless leg and fibromyalgia patients respond quite well to a low dose of CBD in the evening. You want to take it before your symptoms typically start, and you can again take it either systemically in a tincture or oil under the tongue, or you can actually use it topically on your legs or whichever areas tend to bother you and wherever you experience that restless feeling. So to review, there are 3 really effective natural treatments for restless legs, and any of these 3 treatments can be applied either systemically or topically. And the 3 that I have found to be most effective are iron, magnesium, and CBD.